Hi, I'm Dr. Colt Canepa here with HelpfulDentalTips.com. Today we're going to talk about retainers, what you get following orthodontic treatment. Something that's maybe surprising is to learn that once your teeth get moved with braces, you actually will never have them hold that spot naturally. In fact, teeth will tend to revert to their original position over time. The way that that's prevented is with what's called an orthodontic retainer. Those are very, very common nowadays. Anybody with braces has at least been told about them. Most people have them in some form of it or another. It's important to know that there's a couple different ways they can be done. So I'm going to talk about 3 primary forms to see if one might appeal to you more than another. The first kind is called a fixed retainer. That one is glued to your teeth. It won't move. It stays there all the time. There's 2 other types that are removable retainers. Now, these 2 are called a Holley retainer and also a retainer that can be called a suckdown. A fixed retainer is typically called a lingual holding wire. You can put those on the entire tongue surface for the front teeth, and you can move it back a little farther if you desire as well. Those use composite and they stay on your teeth. The challenge with those is you have to floss them and brush them very diligently. You also may need a floss threader or some additional device to help you get floss in between your teeth because they may be glued to each specific tooth surface. The benefit is you can't lose it, your teeth will always be in their same spot, and you don't need to worry about being compliant with it every single day because it's already there for you. Thinking of that option, which is very popular, I want to share 2 other ones with you that are less common but also very effective. One that I mentioned, a suckdown retainer. This is literally just a clear outline of all your teeth in one arch. When you have it at night, you take it, you put it on over your teeth, it keeps them safe. Just like a night guard. Thinner, more comfortable. Another option is what's called a Holley retainer. This retainer has a metal bar that is built into the plastic. And when you put it on your teeth, it clicks in and holds its place. Now, it's not made for this model, but a Holley retainer does the same thing as any other one, and it's removable, and it's a more traditional approach to it. The benefit of both these removable ones is you can take them out, you can floss your teeth immediately, you can brush your teeth, and at the end of the day, maybe there's an added benefit for the convenience of it. The best way to clean them, with the retainer that stays in your mouth, the lingual arch, best by brushing and flossing. I would urge you not to let too much time go by with that because buildup can accumulate and then you may need some more advanced cleanings. In terms of the 2 removable retainers, using warm water and either your fingers or a soft bristled toothbrush with some hand soap, nothing too abrasive such as some types of toothpaste, and just gently brushing them to remove any of the buildup that may sneak in over time as so needed. And on a more general note, daily basis, using warm water with just some regular hand motions to dislodge anything that built up overnight is a very sufficient way to keep them working nicely for you. Thanks so much for watching. This helpful tip brought to you by Dr. Colt Canepa of HelpfulDentalTips.com.